Namaste बिटिया हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science, Jyoti Vidyapith Women's University. In today's lecture, we are going to discuss about the clinical examination of respiratory system. We are going to discuss about palpation in today's lecture. In the last lecture, we have discussed about inspection. Today, we are going to discuss about palpation. Palpation has four potential uses. Number one, identification of the tender areas, assessment of the observed abnormalities, example, to confirm the findings of inspection, further assessment of the chest expansion by measurements, and assessment of tactile buccal firmness. I will again repeat these 4 points. Identification of the tender areas means the painful areas. Assessment of observed abnormalities, example, to confirm the findings of inspection. Further assessment of the chest expansion by measurements. Assessment of the tactile buccal firmness. Now, what are the steps of examination? There are different steps of examination. We are going to discuss them one by one. Number one is palpate the chest wall for any kind of swelling or bony prominences. You have to palpate the chest wall for any kind of swelling or any bony prominences that are visible. Note the position of the cardiac impulse. You have to check for the position of the cardiac impulse and palpate the trachea for any kind of deviation that has to be checked for. The observed asymmetrical expansion of the chest must be confirmed by the palpation. If you have observed any kind of asymmetrical expansion of the chest during inspection, then that asymmetrical expansion has to be confirmed by the palpation. I will again repeat the steps. Palpate the chest wall for any kind of swelling or bony prominences. Note the position of the cardiac impulse and palpate the trachea for any kind of deviation. The observed asymmetrical expansion of the chest must be confirmed by palpation. This way, you have to palpate the trachea and you have to check for the expansion of the chest. In this way, you have to measure the chest expansion after inspiration. In palpation of the trachea, you have to use the three-finger method. This is the procedure of manual measurement of the chest expansion, both from the front and from the back. You have to keep both hands in this way and at the chest of the patient, and then you have to check for the expansion of the chest, both in the front as well as in the back. Palpation of the intercostal spaces. Then you have to palpate for the intercostal spaces of the patient. In case of abnormal chest, palpate the intercostal spaces. You have to palpate for the intercostal spaces with pulp of the fingers in each side of the corresponding levels to know any widening or narrowing. So you have to palpate of any of the intercostal spaces, and in case of abnormal chest, you have to palpate for the intercostal spaces with pulp of the fingers on each side. You have to check on both the sides at the corresponding levels to know the widening or narrowing of the intercostal spaces. The next, you have to assess the tactile buccal firmness. You have to check for the tactile buccal firmness. The tactile buccal firmness refers to the perception of vibrations. The vibrations that are transmitted to the chest wall from the voice box, that is the larynx, via the tracheobronchial tree during the act of phonation. So you have to assess the tactile buccal firmness. What is tactile buccal firmness? It is the perception of the vibrations that are transmitted from the chest wall, transmitted to the chest wall from the voice box larynx via the tracheobronchial tree during the act of phonation. Whenever we are speaking, the vibrations are transmitted from the larynx to the chest wall via the tracheobronchial tree. That is known as assessment of the tactile buccal firmness. This is the method by which it is done. All right. It is observed both the sides and asking the patient to say 1, 1 or 99. What is the method of tactile buccal firmness? Tactile buccal firmness is detected and compared on both sides of the chest using the ball or the ulnar surface of the hand. When the patient is asked to repeat some words, say 99 or 111, the examining hand perceives distinct vibrations. I will again repeat the method. Buccal firmness is detected and compared on both sides of the chest using the ball or the ulnar surface of the hand. When the patient is asked to repeat some words in say 99 or 111, the examining hand perceives distinct vibrations. This is the way of doing tactile buccal firmitus by observing on both sides, comparison and made on both sides corresponding areas from above downwards towards the lower part of the chest. These are the sides on which the tactile buccal firmitus is perceived on both the sides, 1, 2, and 3, from above downwards on both the sides symmetrically. Now, other palpable vibrations include a palpable pleural friction rub. We have a palpable crackles or rails and palpable wheeze or rhonchi. These all have to be checked for. These we will be discussing in the practical class because this cannot be discussed here with this video. We have to check for the palpable pleural friction rub. We have to check for palpable crackles or rails and palpable wheezes or rhonchi. So this was all about palpation. Next, in the next lecture, we will be discussing about the percussion in the respiratory system. This session was powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.